Hiya, it's Dr. Heather. I haven't made a video for a while, but the kids are back at school, thank goodness, so I thought I'd get back to it. And I was inspired to make this video because on TikTok and YouTube recently there's been a trend for videos about propaganda I'm not falling for, where beauty and fashion influencers talk about all the popular marketing tropes which they're not falling for. And unfortunately in private healthcare there is a lot of marketing, and I see a lot of our competitors offering tests or treatments which I don't agree with. So without further ado, here's some private healthcare propaganda I'm not falling for, and I think you shouldn't either. So firstly, IV drips. Unless you're sick enough to be an inpatient in hospital, or you have some vanishingly unusual digestive condition, you don't need an IV drip. And if you're feeling run down, or you think your diet isn't the best and you think maybe you need more vitamins, just take a standard multivitamin that you can buy over the counter and drink plenty of water. There's no need to use an IV drip. And actually, having a drip can expose you to some potential harms and risks. You need to have a cannula put in, and having that needle put in your vein puts you at risk of bruising, bleeding, or even infection. And actually, some vitamins are less safe at high doses. Sometimes IV drips are advertised for rehydration, but again, if you're actually dehydrated enough to need IV fluids, you probably need inpatient monitoring in hospital with a nurse monitoring your fluid input and output and regular blood tests. So, long story short, these IV drips that you see advertised for wellness, basically they're just a way of ending up with expensive wee. Don't fall for it. So the next point on my list is Kenalog for hay fever. So this is a long-acting steroid injection which dampens down the immune system, which can make hay fever symptoms better. And Kenalog used to be all the rage, maybe 20 odd years ago. NHS GPs offered it. But the reason that the NHS no longer offers it is that actually research shows it's no better than other treatments which are safer. There is international guidance saying that doctors should not be using Kenalog for hay fever. And actually long-acting injected steroids do carry a lot of risks, including risks around weight gain, worsening your blood sugars, and potentially affecting your mental health. So if you've got hay fever, don't go and get Kenalog. Come and see us for a discussion about safer options. And then my final piece of propaganda I'm not falling for is my biggest bugbear: expensive well-person health screening packages. Do not get me started on this. A lot of our competitors will try to scare you into spending hundreds, if not thousands of pounds a year on all kinds of blood tests, even if you feel completely well and you have no symptoms. Now, as a rule, it's only worthwhile screening for a condition if the condition is a serious one, if early diagnosis has been shown to make a difference to outcomes, and if there's a treatment available which is more effective if started early. So there are some conditions for which screening is really valuable. A good example is bowel cancer, which is screened for on the NHS. Earlier diagnosis has been shown to make a difference, and the stool test that's used is easy to do and has a good pickup rate. So what I would say to you is that as a general rule, if a screening test is worth doing, the NHS usually offers it, because actually treating cancer is expensive. So actually, if screening works and is worth doing, it is usually cost effective for the NHS to offer it. And the problem with one-size-fits-all health checks is that actually research evidence shows they don't work. So there is a Cochrane review, which is the highest grade of evidence there is, which shows that health checks do not reduce patients' risk of death from all causes, do not reduce patients' risk of dying from cancer, and have little to no effect on heart disease outcomes. And there's actually a risk that generic health checks do more harm than good, because whenever we do tests, there's a risk of false positives, and that can result in patients having unnecessary tests and treatment, and actually causes a lot of worry and stress as well. And then on the flip side, there's the risk that a patient with symptoms might be falsely reassured by normal test results. So it really is best practice only to do tests when they are appropriate, such as if a patient has symptoms of illness or certain risk factors or a family history of something, or if it's part of an approved screening program. So if you want a health check, our process is we don't offer standard packages. Unlike a lot of our competitors, you can't just book in online for 800 quid's worth of bloods. our process is that you book a GP appointment first, because patients almost never request a health check for absolutely no reason. Normally, patients have symptoms or a family history of the condition they're worried about, or maybe they're a bit nervous about factors in their lifestyle. So in your GP appointment, we will discuss any symptoms you have, we'll talk about your family history, we'll talk about your lifestyle, any other risk factors for illness, explore anything that is worrying you, and then we agree together on a plan, including any tests you need. So we can and do blood tests privately. We can also do ECGs, and if that's appropriate, we can normally do that straight after your GP appointment. So that's it. What I would say is, I think, perhaps sometimes trying to practice medicine ethically almost makes you a bad business person, because, what I'd say to you is, I'm not in the business, we're a private service, but I'm in this to practice good medicine. I'm not here to flog you stuff you don't need. And I think it's really important that when you come to see me, you trust that I'm acting in your best interests rather than recommending treatments because they'll make me money. And that's not how I work. And maybe that makes me a bad business person. And maybe that's why, I'm not rolling in it. But honestly, I think for me, the principle's got to be first do no harm. So that's why we do what we do. So there's a list of some of the things that I'm not falling for, and I would suggest that you don't either. Great, well, hopefully I'll get back into making more videos. I hope to see you soon. See you then. Bye now.